Welcome to Talking HealthTech here at Health 2024 in Las Vegas. I'm here in the podcast studios on the expo floor, and I'm joined by Serge Lauriou from My Medic Watch. How are you, mate?
I'm very good, thank you. Nice to meet you.
Nice to meet you. I think it's funny that we've tried to organise this interview for, I'm sure it's been 12, 18 months, and it took us going to the other side of the world in order to be able to do it.
Okay, that's fine.
You know, based in Australia, but you're here in Vegas at Health. Before we dive into My Medic Watch a little bit more, firstly, what brings you to Health?
I mean, Health, in fact, that's one of the big conferences you have to be there, okay?
Yeah.
Mainly for a medtech company. I've been to a bio conference in San Diego like a few months ago, whatever, but Health is the main one. Mm-hmm. I made the one in Europe. I think you went for the last one in Amsterdam last year.
Yes.
But now for us, in fact, we have to be there. So I am here this year, very happy with that.
Interesting. So, and I understand a little bit about My Medic Watch, obviously, as THT partners, and I understand it's a global issue to address. Set the scene for us. Tell us a little bit more about My Medic Watch and the work that you're doing.
Yeah, sure, of course. So we started that 4 years ago. Mainly what My Medic Watch does is a medtech company, developing smartwatch apps. Okay, so that's an application running on commercial smartwatches. Okay. And so we got an algorithm that's working on a smartwatch, which automatically detects seizures, falls, and cardiac events. So that's what we call smart detection apps, okay, which provide help for people who need help, okay. So if someone has a fall, okay, they're on the ground, they really need to be helped by their caregivers. So the application automatically sends notification to caregivers, again, number one. And with a GPS location, they can go and help them. So that's an app has been on the market for 3 years now. Okay, it's working very well. Our main customer base in the US, in fact, by numbers, I suppose. Okay, but we are moving to B2B now, knowing that we capture continuously a vital sign from the smartwatches. Okay, all the sensor we can get from the smartwatches. We capture all these continuously. That's very important, okay? And we got machine learning and AI to be able to analyze, okay, the health profile of this particular person, okay? So, and our goal, and maybe we'll talk about this a bit later, but it's to be able to predict, okay, when a medical episode is going to come up. So this... all this data coming from commercial smartwatches, okay, will be given to healthcare provider, home care services, and they can provide a better service. In fact, have a better view, okay, of the patients, okay, and to provide a better services, okay, for the patients.
That's interesting. So you mentioned, the app's been around for a while, and the capability certainly exists, and there's a shift or an interest to move more to that B2B type environment. So historically, has it been so consumers directly downloading the application, using it for their own purposes?
That's correct. So I mean, that's our organic growth. We put the app on the app stores. Yes, people search for seizure detection, fall detection, cardiac alert, something like this. And they found us and they download the app, okay, on their phone and automatically install on their smartwatches. And that's it, and it's running. So that's running on the background. So no stigma, okay, that's important. And that's running automatically.
Yeah.
So that's this B2C market has been running for the last 3 years, okay, and quite successfully. But now, as you said, in fact, we need to move to B2B.
Yeah, and that move to working with the providers and kind of grouping the patients by facility or whatever it might be. Like, what are the benefits of being able to do that? Like by aggregating those directly through to the hospitals. Like from a provider side, what benefits do they get?
Yeah, so they will get quite a lot of benefits. I mean, the main thing is, you can get a lot of data now from smartwatches. Okay, so. And as we do continuously, which is not easy to do, but now we can do that. So we can provide the dashboard, okay, for them to have a good view of the general health of the patients. Okay, so that's one point. Okay, so we provide the dashboard for that. But I mean, it's not enough. I mean, is it got a dashboard? That's fine. Okay.
Yeah.
But the main thing, in fact, with ML and AI, okay, we can alert them if something is not correct. Okay, so if I'm taking the case of older person living at home, and they are not doing any exercise for the last 3 days, for example, and they should do the exercise, okay, that's going to be a warning for healthcare provider home care services. And in this case, they can provide a better services because they are going to provide the services when something is happening, okay? Yeah. If everything is fine, okay, they will know that. But if something is happening or something is wrong about the heart rate or they had some cardiac event or whatever, okay, they can provide a better services. So the AI will provide them, okay, to give them a better understanding where the health of the patient is going.
Yes. And you mentioned as well, it's an app. Is there any hardware involved, from your side, or is it just utilizing the existing, consumer technology that people use?
Yeah, it's a good question. In fact, our view is to go to commercial smartwatches, so we are not providing any hardware.
Yeah.
Okay? It's too complicated. So anyway, commercial smartwatch, every watch manufacturer get their own SDK, okay, and health kit if you want. Okay? So it's pretty much per smartwatches brand, okay, which make them a little bit complicated.
Yeah.
For example, we got a prototype now working fine on Samsung smartwatches, okay, the 5, 6, and 7, and you have to be part of the health SDK if you want programs, okay, to be able to get all the data, all the value from the sensors, okay. So that's pretty much smartwatches brand, okay. So that's a lot of work, okay. So we nailed down, in fact, completely continuous data monitoring and capturing from Samsung at this time, and we started to do from Apple, and that's going to be many after that, okay. But so hardware is a little bit involved, okay, and what we want to do is to make sure that we can capture continuously all the data from all the sensors, okay, from new smartwatches.
When you talked about the, incorporating artificial intelligence and machine learning, I can, as you're describing that, and as I think of the big picture, that makes sense, because that's one thing to capture all of this information and all of that data, but then, and as you say, you could put it on a dashboard and see a nice graph or kind of alerts that just information that's on the dashboard there. But in this current climate where healthcare systems need to do more with less, there are workforce shortages and burnout amongst clinicians, and the population that needs caring is increasing burden of chronic disease and aging population as well. So I guess it is this kind of mixture of a need for us to look at how we do things differently, right?
That's great, in fact, because, providing a dashboard with data, what do you do with that, okay?
Yeah.
And, of course, short staff, okay, they are not going to look at the dashboard every minute, of course, okay? So by providing a system and AI to alert them if something is not correct, okay? So, as I said before, in fact, if, elderly person is watching TV for 3 hours, okay, we know that, okay, and maybe something is going to happen when they get up. Or if their average heart rate, okay, is not as normal, okay, the staff will be alerted, okay. So we help healthcare provider staff, okay, to make the right decisions, okay, by alerting them if something is not correct in the patient health, okay.
Yeah.
They can't do it one by one because, short resource of staff, of course. So they can't, visit elderly every day. It's not going to be the case. So by having all this data, using AI to interpret all this health profile for these patients, okay, we can alert the staff that something is going wrong, okay, what they need to do a better service. So it's many, having a healthcare provider to provide a particular care, personal care, okay, to the patients, and only AI can do that.
Yeah, and that's one thing for us to see information as it's happened, and even alert providers about, hey, something has gone wrong or needs your attention. You talked about the potential for prediction as well. Tell me a little bit more about what you're working on that.
Yeah, so we got a patent on this for detection, which is what we call a smart detections. Okay, so which automatically need to help the patient that's going to be on the ground after a fall. Okay, so The main thing on this one, fall detection is quite complex, okay? Even Apple has got smart detection in the app, but it's only for hard fall, okay? For us, it's a little bit different because everyone is different. A short lady isn't going to fall the same way as a tall guy, okay? So it's a bit different. So we've got settings that's working parallel with the algorithm that people can set regarding their medical condition. That's unique, okay? So we got a good rate of detections, okay, on fall. So if someone is falling and not getting up, okay, meaning that they need some help, okay. Give you an example, someone is falling. After a fall, usually you see a little bit of shaking, okay. Our algorithm take care of that, okay. So we know they are on the ground, they need some help, okay. Same thing for seizures, okay. Seizures have a different algorithm, but again, in fact, if someone's got a seizure, they will need to get help very quickly. So that's a smart detection app, okay, which in fact, is there to make sure the patient got help very quickly. That's very important, okay. And by combining this with all the data we collect and with AI running, what we want to do is to predict, okay, we don't want people to fall, okay, because it's very expensive, okay, they break their hips, they go to the hospital, they stay for a long time, okay, so what we want to do is to warn them, say, okay, be careful, maybe you're going to fall. So in this case, there's going to be a warning, the prevention will be there, and they should fall less or maybe not at all. Right? Yeah. But that's going to be only by using the AI.
How does that? What would it be using to predict those falls? Like, so it's just all those indicators that are coming through the watch.
That's correct, and we record everything. For example, if we call near fall, someone is falling, okay, and they get up very quickly, so we don't send alert because they are okay, but we know that near fall, okay. So we capture that part on the profile, okay, and we get in what they've done before, like maybe watching TV for 3 hours or whatever, okay. We know that's the next step if we see through AI, in fact, the same kind of scenarios, okay, or maybe they're going to have a fall, okay, and we send alerts, okay. So the combination of the algorithm running on the watch to capture automatically the fall, that's fine, okay. But the main thing is to have all the data coming from heart rate, everything, okay, and the combination of what they've done before to warn them, say, okay, be careful, you might have a fall.
Yeah.
Okay. And same thing for seizure as well. I mean, research has been done on a seizure that your seizure happen in fact on the average heart rate. Everyone's got the average heart rate of cycle.
Yeah.
Okay. And they found that the seizure happen, okay, matching in fact your average heart rate. So we use that, okay, and be able to predict or warn people, be careful, you might have a seizure.
Yeah. What are so, every year Apple or any phone provider or technology provider comes out with an iOS update or a watchOS update and say, hey, here's some new features that exist within it. Like, why does My Medic Watch need to exist if there's all this, new technology that's coming through these consumer devices? What are the chances of Apple just having this capability within it and kind of baked in? Like, why does it need to exist?
I mean, that's fine. I mean, they provide features to sell watches.
Yeah.
Okay. That's our brand manufacturer. Okay. So they say, we've got a fall detection. That's about 2 years ago. Okay. We say, oh my God, okay, we've done that before. What's going to happen? Okay. But in fact, they only have a feature to detect hard fall. Okay. Right. And if we go to sport, it doesn't work for the rear. In fact, you can search on Google, you will see this very interesting video on that, okay? That doesn't work. So for us, because we've been working on this one to help people when they have a fall, okay? Having a fall is fine. In fact, even Apple, there's some issue in the US because automatically that's what's calling 911, okay? No, we don't need that, okay? Yeah. So for us, it's a little bit different. We analyze this, okay? And we send alerts, okay, to caregiver only if it's a real fall. Like it's people on the ground waiting for help, okay?
Yeah.
So, and we've got a full notification system to all caregivers, second, and nurses, healthcare provider as well. So to make sure they know what's going on. Okay, so if one caregiver is going to help Peter where to fall, okay, all the other caregiver knows about that.
Yeah.
That doesn't exist, for example.
Yeah.
Okay? So all these kind of things.
I kind of predicted that would be the answer, or I hope that would be the answer, because that's one thing for consumer devices to provide the capability, but one thing that's always missing from that kind of solution is that integration back into the healthcare system and tying in with the care providers and then incorporating that as part of the continuum of care. So I think there's always a need for these types of solutions to exist, to really double down in these types of areas too, and provide that next level of care rather than just kind of interesting information that might be provided through a consumer device. So that makes sense. And so forward facing, looking ahead for My Medic Watch, there's some interesting technology stuff that you're working on and opportunities to broaden that capability. Where are your priorities at over the next kind of 6, 12, 24?
Yes, our priority is to nail down the predictions, analytics, and using AI, because I would like to provide an app that's really predicts when you are going to have a medical episode, so to make sure you don't have a medical episode, because there's some things. So we are here, in fact, to help people who's got medical conditions. So pushing AI, doing a lot of research as well. So we are trying to find some partners, some researchers and like this to nail down, in fact, our AI predictions. And for this is to find partners as well to move a B2B, as I said. So that's a lot of things to do.
Yeah.
I mean, when you talk about the population aging, you got so many people, in fact, who want to stay at home. Aging well as well is very important. So all these kind of things need for us is to find partners with home care services, healthcare provider, to use our capability of AI to help them, helping in fact the patients, to make sure they don't go to the hospital and aging well. So that's the thing.
Yeah, lots to do. Well, Serge, I really appreciate making the time here at Health. I'll let you get back out onto the floor and enjoy some of the sessions, but we'll put some more details from this episode in the show notes of the episode and on our website. So I really appreciate you making the time, Serge. Thanks.
Thank you, really, Peter. Again, have a wonderful time at Health in the US. Yes.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.